A pleasant day and a warm welcome to your favorite medical discussion, iMed. iMed is a program where we distribute knowledge about medical concerns and even giving you advices to lead a successful life. This series of programs were focused on skin. We considered about certain effects, conditions and consequences, and today we are going to focus on one of the most specific areas. Yes, it concerns about the beauty, but when it comes to some surgical interventions, today we thought of discussing about cosmetic surgery. So we invited Dr. Tushan Benragama, consultant plastic surgeon, to do the honors. Thank you, sir. Thank you for joining us.
Thank you very much for the invitation.
Okay, so when it comes to the skin and the beauty, the external appearance, people consider a lot, because the skin is the portrait, that means the personality, and many things are concluded when a person just randomly sees a particular figure. So that maintains, and each and every one of us would like to maintain that type of an elegant beauty. When it comes to this skin, is we have to maintain those things, and cosmetic surgeries play an important and vital role. And to start on the discussion, I may ask, sir, what a cosmetic surgery is?
Yeah, cosmetic surgery, we call it aesthetic surgery, and those are the type of different surgeries we do to improve a person's appearance and to give a better contour to maybe the tummy, maybe the chest, maybe the arms, depending on the different part of the body. So that is a spectrum of multiple surgeries from head to toe, and not only the surgeries, there are what you call non-surgical procedures. I think that is also very popular now, because some people without doing surgery, so you can do certain procedures to improve and enhance the overall appearance, especially the face. So there are what you call cosmetic surgery, and there are non-surgical procedures as well.
Right, that means when it comes to this discipline, surgical interventions, and without performing the surgeries, there are certain mechanisms that we can proceed with.
We call it minimally. There are what you call minimal invasive things, because we with injections, and they are very safe. For an example, we call it, in general, we call it fillers, and we inject what you call Botox, that is a botulinum toxin. That is to improve, that is to minimize the wrinkles, minimize the certain areas, the appearance, and improve the appearance. So those are what you call minimally invasive procedures. And there are procedures like laser, and they do with machine. There are so many things they do. So it's a spectrum, and sometimes we combine surgical and maybe minimally invasive and maybe the non-invasive things to improve the final outcome.
Right, and so always what we consider the outcome of this thing is to improve the appearance and the contour that we are expecting. In certain cases, people try to perform, like they come up with their own advice. For example, a certain condition is there, they're suggesting, yes, I need a surgical intervention. Can a person itself suggest, or he or himself can perform? Can they just require, I want this surgical thing, or it's up to the physician? Now we can manage with it, non-surgical, might be surgical, a combination of both. How it deals with?
Yeah, in clinical practice, a patient comes, or they come with certain idea, like say, okay, I want to improve my chest. We'll say a young boy, 25 years, or maybe young age group, they say, I want to improve my chest because I don't like my chest. It's like, but that patient may be 120 kilo patient. So then that they are not the ideal category to do that. I think the first thing is and they ask whether let's say 120 kilo person will come and say, okay, I want to lose weight. Can you do liposuction and reduce weight? So then the answer is, what we say is, these cosmetic surgical procedures are not weight reduction procedures. So even if they come with an idea that okay, I need surgery, so then I can lose weight and my appearance will be better. So that is not the case. So first they have to lose weight, so then we can handle the different areas in the body.
That means cosmetic surgery is not a surgical intervention that we can create a different figure out of a person.
Absolutely, yes.
That means minor corrections, as I mentioned, as you mentioned, small scale changes could be made, but a 120 kilo person can't be made a body built, well built person.
Exactly.
Right. In that case, what you can specifically take that idea is cosmetic surgeries are there, but there are things that you have to perform and you have to proceed with before coming to a surgery. And so you mentioned about a specific category which is specifically fitting to certain surgeries. Can you just explain what sort of a person who is just best fitting to perform that type of a correction?
Yes. Now we'll say, like, after pregnancy, the women, they put on weight, their muscles will stretch, and the tummy may be sagging. So they can come and say, okay, can you improve the tummy? Mm-hmm. Yes, that group, yes. So they are like, fit into that category. But there are patients, they have what you call unrealistic expectations. Okay, I want to fix my nose like this,
right,
like look like this photograph. And so we cannot do like that. And can you change my face to look like this face? No, that is not possible. So it has to be they should have a realistic what you call the objectives and ideas. So unrealistic things we cannot do.
If I may ask, are there any ethical violations?
Not ethical things, but finally, like, if they suggest something and I offer something, if we cannot match, so then finally they will be very unhappy and I'll be very unhappy as well. So that is the difference in this cosmetic surgical procedures and non-surgical procedures as well. So they should have a proper idea about what they want and what we can offer.
Right. It should be like ideally matching for both the parties. Why? Because sometimes people might be expecting numerous things. I want to reduce my weight, just the fat reduction procedures, and I want to build up my muscles, the chest, and I want to look like this person, the nose, face and everything. Just this appearance is the thing that I need. Doctor, please do. You say you can't, right? Because that is not the outcome from that doctor. And so when it comes to these cosmetic surgeries, what we perform, when that particular group of patients, if they are fitting, are there any precautions that you should consider before a surgery? Sometimes people think that, right, before this surgery I should maintain this type of a hygiene. No, sometimes people say preparation to a particular surgery. Are there any specific preparations adherent to this?
Yeah, there is always a preparation, because some of them these procedures can be done under local anesthesia, that is without anesthetizing the patient. And most of the procedures we do under anesthesia. So there are certain risks involved. So to minimize those risks, and there's what we call screening. So we have to get some tests done, we have to meet the anesthetist. Then only we decide to operate, because we don't just admit and do the surgery for the following day. The reason is because we want to make sure that we perform a safe operation.
Right. So another practical exposure, if a certain person's skin is badly injured, if there is a huge area to be filled, we just try that. They take the skin from another place and apply that thing like grafting. There are some cases that people deal with. So in that case, for example, just to enlighten the general public, so what sort of places that are more suitable to do those types of grafting? Is any place suitable to do?
It depends. Like, if you will say, like, following an accident, if you lose part of your face or maybe part of your arm, So then maybe a skin or maybe soft tissues. Soft tissues means sometimes like you need replacement of that particular area with not only with skin, depending on if it is a major injury, skin and fat and maybe muscles and maybe bone. So it can be done. So we call it we transfer tissues from a same patient from another area to maybe the face or maybe the hand, maybe the lower limb. And these we call reconstructive surgeries. So when we do the reconstructive surgeries, we always consider cosmesis. That is to give the best possible scars and minimize scars. And so therefore when we take the tissues, maybe the skin and maybe the other tissues, we always prefer to take the skin from we call donor areas. So take from a hidden area, maybe mostly the thigh. So you can cover with clothes, right?
Yes.
So like that. So in that type of situation, we after explaining to the patient, maybe the thigh, maybe in a hidden area like back of the chest or maybe the what do you call it, the side of the chest. So we take tissues from those areas.
Right. So we are not going to expose much on that, the reconstructive aspect. The
It's
cosmetic,
a
totally different topic.
Totally different
so I think before the prior discussions, you said the cosmetic surgeries are there, and reconstructive aspect is totally different. And so we discuss about certain risk situations. So can you just explain what are the risk situations dealing with?
No, the most important thing, most of the time they ask, is it safe to do it? And we'll say like there are situations the wife will come for a surgery like body contouring surgery. The husband may not like it, or maybe the parents might not like it. So the main concern is the risk. So because risk of anesthesia, the complication of surgery, then your hospital stay can go up, and so there are certain consequences like they have to face. So therefore we discuss everything before the procedure, and that is why you always try to identify the best or the ideal patient for that particular procedure. So that patient selection is very important, because finally you should minimize the risk and think about the patient's safety. And so then finally the most important thing, like we enhance their beauty, but at the same time they'll be finally very happy, because they have gone home without a major risk. But even if you operate 100 patients, about 2%, 3% of the patient can get like wound infections, wound breakdowns, and they are called minor complications. But we always try to minimize the major complications, maybe related to the anesthesia.
Right. So apart from those anesthesia and related major concerns, can you just explain? People might think, yes, there are some surgeries that we can perform with, but doctor explained about some major concerns and consequences. So can you just explain a bit more on that, sir?
Even like now we are talking about cosmetic surgery.
Yes.
Without cosmetic surgery, like we'll say you undergo for thyroid surgery or maybe a bowel surgery, but that patient will have the same risk. But it's a different situation, because if you are undergoing for maybe a cancer surgery, the circumstances is different. Because here you can live without.
Yes, it's a life-threatening condition.
Yeah, exactly.
Yes.
So that situation is different. So therefore we make special precautions to make sure that, because otherwise they are healthy people. But sometimes they may be having diabetes, pressure, but still these are not absolutely essential surgeries. But those surgeries are important for them to improve their self-esteem and to look better. So for psychologically they feel better. Right? So that is for that. So we take extra precautions to identify the problem and we call optimize the issue.
And minor complications, sometimes infections, wound breakdowns. Can you just explain a small thing about that, sir?
No, that any operation even not only the cosmetic surgeries, other surgeries also, like the wound can get infected, but that risk is, I would say, maybe a very minimal. I would say maybe less than 1%, because it's all about the cleanliness and the sterility and related to that.
Right, okay. So it's very much clear for you all when considering those types of major and minor consequences. Surgeries do have the commonest things after each and every surgery. There are certain things that you have to deal with post-surgical interventions. Yes, there might be. But the situation is different here. The life-threatening conditions, you might be not really asking about any consequences. If you have a cancer and don't operate, it will remain a scar. You won't say like that. But when it comes to these cosmetic surgeries, you can live without doing that surgery. You live with the problem that you are dealing with, but it might be comparatively affecting you regarding your personal appearance and self-esteem and those types of things, so on and so forth. That thing you have to identify what you are going to perform, the consequences and the procedure related with. And sir, when it comes to these cosmetic surgeries, this is a vast area, and people might be having, I think, within your career, and you might be having many exposure to number of patients, might be thousands and more. What are the commonest types of things that people request in this context of cosmetic surgeries?
So for that, both male and female, they come for these surgeries. Like men, especially we call the chest, male chest, we call male breast enlargement, or called gynecomastia. And so we do surgeries to improve the appearance of the chest, or maybe the liposuction of the tummy. So that is the men. And both men and women, we do what we call facial surgeries. And women, there are what we call one of the commonest operations we perform, called abdominoplasty or tummy tuck. So then the breast surgeries, we do breast reductions. If it is a large, so we reduce, and if it is sagging, we do what we call breast lift. And so there are multiple breast related procedures we perform. Then the nose, we do what we call rhinoplasty, that is to improve the shape of the nose. And there are other procedures we do for the face and the neck. So there are multiple procedures we perform safely. And but I would like to tell you something, because about the timing of surgery. Because some people, they will come and say, okay, I'm getting married, or I'm traveling next week, can I do the surgery? Right? So because they need some time to recover. And after this cosmetic procedure, especially after liposuction, you get certain amount of swelling, and they need what we call compression garments, and they need some time to recover. Even the other open surgeries also. So therefore, we'll say, if somebody is getting married next week, and to operate this week is not the ideal timing. So therefore, you need maybe a few weeks, or maybe ideally a few months before such an event. But at the same time, there are non-surgical procedures we do, what we call the fillers and the botulinum toxin injection. That is also needs some time to see the action and recover. And so it is, if you have an event tomorrow, today is not the best day to do the procedure.
And someone might think that, I want to change the lips, nose, and the chest area, the abdomen, that means the liposuction, everything. Can all things done together?
We do, provided, now to answer your question, we'll do tummy and the breast and lipo together, provided the patient body weight is okay, no medical issues, and safe to operate for more the multiple procedures at the same time. I think the most important, the weight. If we'll say 80 kilo person, so we might not do both procedures or multiple procedures at the same time. But a 60 kilo person, no medical problems, yes. So we will consider that. And
that means depending on the patient and the requirement and the all the other related consequences, because if a doctor is intervening, a medical professional, doctors have ethical considerations. We can't harm the patient.
Exactly.
Yeah. And in that way, it's not all about certain other considerations that if this thing is being performed right, if we are satisfying all the requirements, why can't the surgery be performed? No, it cannot be done. Why? Because it's a certain measure that a physician employs on you as a patient. So how can he harm you? Yes, surgeries can be done one after the other, sometimes together, a couple of surgeries together, but it should be decided upon the intervention exclusively by the physician. You can have ideas, you can give suggestions, but cosmetic surgeries, we always should consider these surgeries, we can live without these surgeries. Yes. And in order to perform that thing, we have to have some sort of patient, am I correct? To change the entire body at once, that is not the real outcome of cosmetic surgery. You have medical interventions due to the development of technology. We can just change some, we can have some alternations in the original form that we are dealing with, and in certain cases what we change, yes, you can have some changes, but we have to have some patience, because if you are healthy, if you are going to change something in your body, if that causes some of the problems that you have never thought of, you will be worried at the end of the day with medical advice and all the other consequences you have to deal with. So finally, as a plastic surgeon, as a professional, medical professional, what advice can you give to the general public regarding these cosmetic surgeries?
Yeah, I think with cosmetic surgery, it's a matter of like even after surgery, like if you can maintain your weight, regular exercises, good diet, healthy diet, proper hydration, yes, so you can maintain that. But at the same time, so some people ask whether there's an age to perform these surgeries. It all depends on you, and even I will say now 60 years, 70 years, it's not a barrier, provided that you are a very active person, your lifestyle, and so it's not a barrier for the age. There's no barrier for the for your age. And so at the same time, like if you're overweight, obese, try to lose weight, and then we can improve your overall appearance, and you will feel much fit also after the procedure and even before that, and your recovery also. And that is another observation. So if you are fit and healthy, and so your recovery will be much faster.
Right. So with that advice, cosmetic surgeries, you can correct some of the defects that you are encountering. You have to have some patience with particular expert advice which is most matching to your requirement. You can discuss, come to a conclusion, and change your appearance, not making a different person out of you, but to change and correct some of the minor things that we can deal with medically, ethically, and there are so many concerns. To not to harm you is the most important thing. So thank you very much, Dr. Tushan Benragama, consultant plastic surgeon, for doing the honors with us regarding cosmetic surgeries. And with the program iMed, we are giving medical advice and concerns and enhancing your knowledge related to considerations when it comes to each and every discipline related to health. So we had a program, a series of programs regarding skin, the cosmetic surgeries we ended with, and all those things is for your benefit. So stay tuned with iMed. Have a pleasant day, and do watch the rest of the programs.